In this video, I'm going to show you a great daily exercise program for the lower back. I'm Stephen Bunting and I'm a specialist MSK physiotherapist, and I've been helping people with musculoskeletal pains for over 25 years working in the UK. And over this time I've seen countless people with lower back pain. And while I would always advise seeing a clinician like a physiotherapist or a physical therapist if you're in the USA in order to get personalised advice and exercises, the programme I'm going to share with you today is based on the most current research as well as my own personal experience of providing a great well-rounded set of exercises designed to help the majority of people with low back pain. Or perhaps for those people who have had low back pain and are now trying to take steps to avoid any further episodes. The exercises shouldn't really be painful. Try and keep any pain or discomfort well below 5 out of 10 on a pain scale, or preferably below 2 out of 10. And if you can't manage that, then just avoid that particular exercise for the time being, but maybe try again in a few weeks' time when your back is stronger. The exercises are designed to help improve flexibility, core strength, and ultimately improve the resilience of your back. They're going to take about 20 minutes and are best done 4 or 5 times per week. Now the program is aimed at the lower back, but if your symptoms are more in the upper back, maybe between the shoulder blade area, then I've done a separate video for this region, and you can check that out up here or in the description. Okay, well without further ado, let's get going. The first exercise is a nice warm-up stretch. Just lie on your back and pull both knees tightly towards your chest. It stretches the hips and the lower back. Hold for 5 to 10 seconds and repeat 5 to 10 times. You can then do the same exercise but with each leg individually. The next set of exercises work on spinal rotation. In this first one, simply let your knees fall out to the side as far as you can comfortably. Hold for a few seconds and then repeat in the other direction. Repeat 5 to 10 times. You should feel the stretch in your lower back. If you want to progress this stretch further, then have one leg straight and the other one bent, and then rotate the bent knee across the body line like this. Then repeat for the other side. Again, repeat about 5 to 10 times. This next stretch works on rotation of the full spine. Lie on your side, rest your lower hand on your knees to keep them from lifting up during this stretch. Then reach as far forwards and backwards as you can with your upper arm. Hold for 5 to 10 seconds in each position and repeat 5 to 10 times. Then repeat for the other side. The next stretch is for full spinal flexion. It's similar to the child's pose in yoga. Feel the stretch along your whole spine. If you can't manage this kneeling position, then an alternative stretch can be done in sitting, like this. Again, hold for 5 to 10 seconds and repeat 5 to 10 times. The next stretch is the sad cat, happy cat. In 4-point kneeling, try and arch your back to its maximum like this. And then let it fall into its maximum curve, like this. Hold for a few seconds in each position and repeat 5 to 10 times. Now we move from the stretches to the exercises, and we start with the pelvic tilt. This is similar to the sad cat, happy cat stretch, but we are now using our postural muscles more to produce the movement. Try to maximise your lumbar curve like this, and then sag down and curve your lumbar spine into the opposite position like this. Note that my head is staying in the same relative position throughout the exercise. I'm not swaying forwards or backwards like this. And this brings us nicely to the next exercise, the slow seated march. First, we try and find the mid position in our pelvic tilt, like this. We then try and maintain that position while slowly taking one foot off the floor. And then the other, in a slow march. Repeat about 10 times. A nice progression of this exercise is to do it while sat on a gym ball, like this. This works those balance and stability muscles that bit harder. This next exercise is also great for lumbar stability. It's the Superman pose. Start by just lifting your opposite hand and knee off the floor. Hold for a few seconds and then repeat for the other hand and knee. If you find this too difficult, then just lift off one hand, followed by the other hand, and then each knee individually. But if you find it easy, then you can start to lift your arm and leg further off the floor like this. The next two exercises are the plank and the side plank. Aim to hold these positions from 15 to 30 seconds or so. You just need to do them once each. If you struggle with these, then just drop down onto your knees for the plank and your lower knee for the side plank. Next up is the bridge. In its simplest form, just try and lift your pelvis off the floor as high as you can and hold for 5 to 10 seconds. To progress, do the same but then lift one foot off the floor. And to progress further, you can cross your arms over your chest like this. This really works your balance and stability muscles. Only a couple more to go now, and next up is the dead bug. This involves lying on your back and then reaching out with an opposite arm and leg like this. A nice progression is to use a gym ball. So while reaching out with an opposite arm and leg, you are then squeezing the ball with your other hand and knee. If you don't have a gym ball, then you could use something like a basketball. The final exercise is a great all-round exercise for the spine, the hips and the knees, and it works the large muscles of the glutes and the quads, which are so important in walking, using stairs, standing up, things we need to be able to do every day. Keep your feet flat on the floor and try and squat down as low as you can. Repeat about 20 times if you can. Okay, well that's the programme. Like I said before, try and aim to do them for about 4 or 5 times weekly while you have back pain, but once the pain has settled, you could reduce them to 2 or 3 times a week to prevent any further episodes. But then do supplement them with maybe a sport or another activity that you enjoy, maybe walking, running, cycling, a racket sport, or going to the gym. Well, good luck. I hope you found the video helpful. Take care and bye for now.